As fears about the effects of the coronavirus pandemic continue, it is natural that people may be experiencing more episodes of anxiety as a result. Common signs and symptoms of anxiety include feeling nervous, restless, and tense, having a sense of impending danger, panic, or doom, hyperventilating, sweating, or trembling, having trouble concentrating and excessive worry, having trouble sleeping. If you are experiencing any of these signs of anxiety, there are some things that you could do to cope. Reach out for help and talk to a trusted friend or individual who could help to distract you from some of the worrying thoughts. Avoid watching too many news items that focus on the negative impact of the coronavirus. Decide instead on a few specific times daily when you could get your news from reputable news sources. Make sure that you maintain some normalcy and regularity in your daily schedule as much as possible. Focus on the things in your life that you can control and do them. You can control what you watch on TV, what you listen to, who you talk to for support, and how you take care of your body. Remember to seek mental health and psychosocial support if necessary. This message was brought to you from the St. Kitts Mental Health Association.
Before touching the mask, clean hands with an alcohol-based hand rub or soap and water. Take the mask and inspect it for tears or holes. Orient which side is the top side where the metal strip is. Ensure the proper side of the mask faces outwards, the colored side. Place the mask to your face. Pinch the metal strip or stiff edge of the mask so it molds to the shape of your nose. Pull down the mask's bottom so it covers your mouth and your chin. After use, take off the mask. Remove the elastic loops from behind the ears while keeping the mask away from your face and clothes. To avoid touching potentially contaminated surfaces of the mask, discard the mask in a closed bin immediately after use.
Extreme sadness and feelings of despair could be some of the things people are noticing in themselves during this unusual time. Pay specific attention to see if you have feelings of discouragement, hopelessness, irritability, difficulty concentrating, and disruptions in eating and sleeping habits. Pay attention to your emotions and talk to someone if they are feeling overwhelming. Focus on positive messages that you get from your environment. Listen to uplifting music, stories, or news items. Distract your thoughts by doing something like reading a book, doing a puzzle, coloring, or playing a game. Humor helps to lift moods. Watch a comedy or have a good laugh with friends. Remember your own strengths. What are some positive things that have helped you feel better in the past? Remember, if you have tried everything and overwhelming feelings of sadness still persist, reach out for professional help. This message comes to you from the St. Kitts Mental Health Association.
We're doing our part to help making sure that the coronavirus doesn't spread anymore in St. Kitts.
Our role here is just to ensure that the public being safe, and at the same time we're keeping ourselves safe. We're ensuring that each other keep at least 6 feet distance apart.
I like the fact that they put this into place, because most of the time the people are not honest. They tend to come and cheat, and many people who are here from since 6, 7 o'clock in the morning, standing up waiting long, and people come in and excusing themselves within the line.
Some of them are 6 feet apart, and the others are jumbled up too much on one another. Each supermarket where I attend, and even in the pharmacy, they're cooperating very well, and it's a good thing that they're doing. Very good.
I am very passionate about being here, performing my duties on the front line of COVID-19. Our job is not so easy, but we all know that someone has to do it.
It's not an easy job, it's not easy, very difficult, but however, conscious of ourselves, and we managed to take on the task.
Prime Minister, you shall top up the price, them money, because they out here in the hot sun to keeping the people them from fighting
and shoving in the line. And what they do is a very, very good job.
We're just trying to do our part to make sure that St. Kitts can actually recover from this.
Yeah, people of St. Kitts and Nevis need to take this COVID-19 thing serious. The more cases we get, the more the place got locked down. Y'all making noise, but y'all still ain't doing what y'all supposed to do. Stop all your yard and use all your masks. That's the only thing gonna help right now.
Many people's income has been severely reduced as a result of the pandemic. There are real concerns about taking care of self and family in this current financial climate. In order to help to manage the stress and anxiety related to financial concerns, focus on gathering information. What concessions being offered by banks and businesses could I rely on to help me? Prioritizing what bills must be paid first. Which ones could be deferred until a later time? Which ones could be negotiated? Brainstorming. What other activity could bring in an income at this time? Remember, financial concerns are very real and could lead to distress and worry if they are left unchecked. Finding a way to problem solve helps to reduce the stress and anxiety that come with financial woes. This message comes to you from the St. Kitts Mental Health Association.
Is on.
Good day and welcome to the National Emergency Operations Center COVID-19 daily briefing for the 25th of April 2020. We thank God for this new day that He has given to us. We also thank Him for life. We know at this time we have come to value life and the preciousness of life more than ever, especially when we are seeing how fragile life can be, and we are seeing death that is coming about because of this pandemic. Thank you very much for joining us for today's briefing, wherever you are in the world. We continue to update you with information, pertinent information, relevant information, current information with respect to the management of the COVID-19 or the novel coronavirus in the Federation. I would like to invite Permanent Secretary in the Ministry of Transport, Mr. Ron Dublin Collins, to give us a presentation with respect to transport. Mr. Collins.
A blessed good afternoon to all. The Ministry with responsibility for transport, and by extension NEMA Committee for Utilities and Transport, takes this opportune moment to update all our citizens and residents on our continuing work amid efforts to protect our people from the COVID-19. Today, we hail the work and the contribution of our bus operators in providing safe conditions for our people to move comfortably, safely, and to reach their desired destination. During this time of great challenge, they continue to ensure mobility for the population amidst constant challenges with threats to their own health. So my report today will focus on the issues and concerns with reference to the regulations for the bus drivers and our traveling public who utilize their services. The ministry has reached out and has established a good working relationship with the bus operators through their organizations. Our several discussions have been well supported by their participation, and we have as a result established a COVID-19 response committee with representatives from all organizations for our bus operators both in St. Kitts and in Nevis. We are indeed grateful for their contribution through respectful dialogue and also for their commitment to continued collaboration. In the first instance, you'll recall that at the commencement of our curfew, provisions were made in the regulations for up to 4 passengers with strong adherence to social distances. These are very difficult and challenging times. COVID is a threat to all, whether you are a passenger or bus driver. The ministry and the National Task Force for COVID-19 has received the full support of all the organizations representing bus operators in their efforts to keep our people safe. Many of you who look at your television will realize CNN and Good Morning America aired video clips of a Jason Hargrove, a Detroit driver who posted a very touching Facebook video about a passenger coughing on his bus without covering her mouth. Days after, Hargrove was dead from coronas. Time magazine hailed Hargrove as a frontline hero. We must learn from such accounts and implement the necessary measures to save lives. The new regulations increase the number of passengers in the main cabin to a maximum of 8 persons with arrangements for social distancing. The one individual at the front is at the discretion of the driver. What is most important is the mandatory requirement for masks to be worn on buses. No one should be allowed to travel on any bus without a mask. The regulations mandate the wearing of masks on a bus, and this is essential to the safety of both the driver and the passengers. Bus operators have been encouraged to practice routine cleaning and disinfection of frequently touched surfaces throughout the entire bus. Proper hand hygiene is an important infection control measure. To assist drivers in protecting themselves, Sun Islands Close Limited has donated to the Ministry of Infrastructure and Transport some 200 antimicrobial water-resistant masks for the use of bus drivers. These masks will be provided to all bus drivers associations both in St. Kitts and Nevis for their distribution to their membership. Our gratitude is extended to Mr. Nariani and the management and staff of the Sun Island Close Limited for their kind contribution. Also, a public awareness campaign is being implemented jointly by the Ministry with Responsibility for Transport and the various bus drivers associations. I wish to encourage our residents and citizens, in particular the traveling public, to give due regard to the measures and regulations to protect themselves and their families. The repeated requests I received today from bus drivers' representatives when they were advised of our presentation on today's briefing is simply to encourage the general public to wear your masks. Let me also encourage bus operators to adhere to the regulations, implement the guidelines offered, and ensure that their passengers are compliant. The ministry will soon finalize other components of the stimulus package in order to provide more assistance to both bus and taxi drivers alike. The Ministry of Transport is also responsible for ferries, and I wish to advise that the ferry service between St. Kitts and Nevis resumes on partial curfew days and operates in accordance with the social and physical distancing and other health protocols. The Ministry of Transport, which also has responsibility for the operations of the air and seaports authorities, wish to make it clear that it fully supports the recommendation of the NEOC and do hereby advise continued restrictions on arriving and departing flights at and from the Robert Llewellyn Bratcher and the Vance Ambury International Airports. So too on ships arriving and departing at and from our ports in Basti and Charlestown, that this remain in place in keeping with Cabinet decision regarding the continuing closure of our borders. Thank you.
Thank you, Permanent Secretary, Mr. Collins. I now invite Superintendent Cromwell Henry, District A Divisional Commander, to address us. And a secret that you must know is that today is Superintendent Henry's birthday, but he's here and he's responding to the call of duty even on his birthday. Superintendent Henry.
Thank you, Mr. Williams. Thank you for revealing the secret. It is my pleasure to be here, even on my birthday. It's my job. I have responsibilities, and I pledge to discharge my responsibilities regardless. Now, I would not be long this afternoon, maybe because it's my birthday, but I just wish to update on the number of arrests, which remains low, and this is a sign that persons, for the most part, are complying with the curfew regulations. For the last 24 hours, there were 2 arrests, one in Nevis, one in St. Kitts, for persons who breached the curfew. This brings today the total number of arrests to 93. And speaking of curfew, I just want to remind the public, I think by now we should be well aware of these regulations with respect to curfews, but I just want to extend it now and speak to businesses. Regulation 6 speaks to businesses, and it says all business establishments shall remain closed except for the following businesses, which may remain open for any period within the specified time. And this is in specific reference to the lockdown period, which we are in now. So the only businesses that should be operating today, on a day like today, is hospitals and medical facilities, businesses licensed to provide private security guard services, and such other businesses or undertakings as may be specifically exempted in writing by the Commissioner of Police. So we see the number of businesses that are allowed to operate today is very narrow, very limited. Hospitals and other medical facilities, private security guard services, and any other businesses that the Commissioner may exempt in writing. And for the rest of us, what is expected of us on lockdown days like today and tomorrow, every person shall remain confined to their place of residence, inclusive of their yard space, and to avoid contact outside of the family, except essential workers who are required to report for work, workers required to report for work under Regulation 6, and Regulation 6, as I just mentioned, spoke to medical hospitals and medical facilities and private security services, and for essential travel for medical emergencies. If there is a medical emergency in your family, or you yourself has a medical emergency, you are permitted to travel to seek medical attention, provided that such persons shall at all times distance themselves at least 6 feet from any other person. So even though you are allowed to be out, you are expected to observe the social distancing protocols. I will end my presentation here this afternoon and again urge residents to respect the regulations and comply with the requirements. Thank you.
Thank you very much, Superintendent Henry. I now invite our very own Dr. Hazel Laws Chief Medical Officer, to give us her report. Dr. Laws.
Good afternoon, everyone. As of today, Saturday, April the 25th, 2020, at 3 p.m., the World Health Organization reports 2,724,809 confirmed cases of COVID-19 globally, with 187,847 deaths. To date, 286 persons have been sampled and tested, with 15 confirmed positive, 244 confirmed negative, and 27 results pending. 2 confirmed cases have recovered, with 0 deaths to date. There is currently 1 person quarantined in a government facility, while 109 persons are quarantined at home. 13 persons remain in isolation, while 637 persons have been released from quarantine. The Ministry of Health would like to thank the citizens and residents of our Federation for their continued support of the measures that are put in place to protect us all. Let us continue to work together to reduce the impact of this disease by exercising social distancing and appropriate hand hygiene measures. I want to remind us that the national statistics and other COVID-19 related information can be found at the official website www.covid19.gov.kn, the St. Kitts Health Promotion Unit Facebook page, and the St. Kitts Health Promotion Unit YouTube channel. I thank you.
Thank you, Dr. Laws. I now invite Mr. Abdia Samuel, Chair of the COVID-19 National Task Force, to address us. Mr. Samuel.
Good afternoon, everyone. Those of you who are tuned in via radio, logged on via the internet, and watching us on your televisions, greetings. Welcome to a wonderful Saturday afternoon whereby we can bring you some updates as it regards the situation report for the NEOC. However, before we get into the reporting, may I humbly request of all of you to join me in a 1 minute of silence for all of our citizens we have lost in the diaspora as a result of the impact of COVID-19. Kindly join me for 1 minute of silence for all of our citizens from St. Kitts and Nevis who have passed as a result of the COVID-19 virus. Thank you. Today, Saturday 25th, the updates are as follows. 311 would have processed a total of 27 calls for the past 24 hours. 20 on St. Kitts and 7 on Nevis. 911, 76 calls for the past 24 hours. The St. Kitts NEOC would have processed a total of 13 calls, and the breakdown goes like this. Permission to be able to move during the time of curfew. 6, health related. 3, one call was received for someone wanting to make a donation, and 3 for general information. The EOC on Nevis would have processed a total of 19 calls. 15 of those calls were related to law enforcement. Care packages, again, were distributed by the Ministry of Community and Social Development and was supported by the NEMA District Volunteer Mechanism. I want to reach out to all my district volunteers, and in particular the district managers and assistant managers, for the hard work and the good work and their commitment to supporting the various communities. I am appealing to all of you in the various communities, in the districts, and again, the districts are outlined in accordance with the constituency boundaries. So therefore, find out who those persons are in your districts. For example, we have Mr. Ron Body in District 1. And we have persons like Mr. Maurice Benjamin in District 7, Terry Morris, District 6, Mr. Boone, we know him as Zeke, District 4. In District 5, we have Mr. Douglas. In District 3, we have persons like Livingston Huggins. In District 2, we have, I'll get the name for you. That one I forget. Vesta, our District 2 manager. Right, so I will get back. Oh, Vincent 4, remind me, that's a little senior moment. That's when you're going. But Mr. Vincent 4 for District 2. So it's important for you to become aware of these individuals because they are the ones who are driving the volunteer mechanism. The COVID-19 Compliance Task Force has done a tremendous job in the first week of operation. They have inspected a total of 285 businesses to ensure they are in compliance with SRO 15 of 2020. So from next week, as I told you before, and I'm speaking directly to all business owners and other institutions and enterprises, that they will be evaluating with further education. After next week, it will be strict enforcement. So I am pleading to you to comply with the regulation, otherwise you are going to be shut down, and after being shut down, you will either be taken to court or some other measures will be taken against you. So therefore, you will be losing because your business will be closed and you will have to wait for your day in court. This is serious business. We are in the business of saving lives. And you see that the Attorney General and his team, which we have to praise, are working day and night to ensure that we have these regulations. And the police are working overtime to ensure that we are safe in enforcing these regulations as well. I wish to commend for this hard work that we have seen for the first week, Mrs. Marceline Hughes, the head of the task force, and also her operations officer, who is helping her with the coordinating of this activity, Sergeant Sophia Henry, and yes, she's the wife of Superintendent Cromwell Henry. So you see the whole family is devoted to national duty. Commendable. They are doing an excellent job. The Quarantine Task Force continues their job in enforcing the quarantine and isolation protocols. So therefore, not because I am not mentioning them, doesn't mean that they're not working. They were active yesterday, and they were active again today. Dr. Laws has not informed me that there are zero persons in quarantine or isolation. So therefore, please be guided accordingly. The RSS plane would have arrived on the Federation yesterday, 24th of April, and it would have left the Federation with samples for CAFA. They landed here at about 12:30 p.m. midday. I wish to acknowledge a number of persons real quickly. in that of Matron Kerry Tuckett, who has assisted with the creation of a PSA, a video that shows how to wear a mask and the proper disposal, well, how to wear it, how to take it off, and also how to dispose of the mask. We are going to continue working with the healthcare sector in providing more of those PSAs so that the general public could be educated. I also want to acknowledge Auntie May of Canary. Auntie May, thank you for the juices. 3 big heavy bottles of guava juice and other juices which are very tasty. Thank you very much from the NEOC and from the nation. I also want to highlight all the highly patriotic and highly spirited citizens and residents who have risen to the call of duty. Continue to do so. It's all of society's approach. We cannot do it alone. We cannot. Again, I want to remind persons that 311 is a health-related hotline. Again, it's a health-related hotline, and I am asking you to please understand this and use the 311 for health-related matters. Again, the numbers for the NEOC are 465-7453, 466-9626, and 466-3874. And as I am concluding, I want to thank all those persons who reached out to me and are asking me to take a day to rest. But when you are in war, there's very little time to rest. However, I was scolded yesterday by my big sister, Dr. Laws, when we finished, and she demanded that I get some rest and eat more on time. So for those who have been sharing the concerns with me, we hear you loud and clear, and I am very grateful for that. I must conclude by wishing Superintendent Cromwell Henry a hearty happy birthday, and thank you for coming out today in the spirit of duty to perform on your day. And as you can see, and the general public must be aware, that Dr. Laws worked on her birthday, Dr. Cameron Wilkinson worked on his birthday, and Superintendent, but you don't soon be a doctor, don't worry. Superintendent Cromwell Henry also worked on his birthday. This is the commitment of this team. And to that, I ask in all the citizens to celebrate these honorable and distinguished gentlemen and lady. With that said, I will now hand it over to Mr. Leslie Williams so that we can get to the interesting part of the questions and answer. But before I do so, persons have been asking about donation from overseas, and there's an account that was set up by the Accountant General's office. If you look on your screen, you will see the information on your screen. So please be guided by that information. There is one for US account, and there's also one for the British pound. Please be guided accordingly. And if you want to make a check out, the check is made out to the Accountant General. Accountant General. Thank you very much. And Mr. Williams is already ready for the questions and answers.
Thank you, Mr. Samuel. Before we get into the question and answer segment, there's someone who called me from Nevis. Yesterday morning, I was not up yet, and the person was very, very enthusiastic, and they wanted to share the news with me that the hot baths in Nevis is a cure for the coronavirus. And they said, we have to let the world know that we have these hot baths up in Nevis, and heat, the heat that they have, this will kill the virus. And I said to the person, has this been scientifically proven? And she said, no, but Mr. Trump said that the heat, and I said, until it is scientifically proven, then we have no evidence. I said science is something that is evidence-based. You have to have evidence. And then we hear that, you know, ingesting disinfectant and injecting disinfectant, so Lysol and Dettol and so on, you can bathe with these things because there's some sort of a cure for the coronavirus. These things are completely absurd. Whether it's a joke or not, it is really not a joke, because these things are harmful. They have harmful chemicals that are hazardous to people's health. It is true that Lysol and all those things and so on can sanitize surfaces and so on, but they are not meant to be ingested or to be injected, or UV light, ultraviolet light and so on is a cure for the virus. There are a lot of myths out there, and you will hear a lot of them, but I would urge you not to pay much attention to them at all, or any attention to them. This question is from Freedom FM. Are lines specifically for essential workers still being enforced at all places of businesses, especially for medical professionals? And the Freedom says that they observed that 2 medical personnel visited banks and other financial institutions yesterday, trying to sort out their finances, and that they were informed that they had to stand in the lengthy, regular line, which resulted in them missing hours of work. They visited National Bank at the Pelican Mall, and they were told that there is no longer the essential line, just 2 lines for seniors and regular citizens. Both instances resulted in their jobs being negatively impacted by the amount of time they were compelled to wait. So the question is there still a line for essential workers? Superintendent Henry.
Thank you, Mr. Williams. The new regulation does not provide specifically for lines to be made for preference to be given to essential workers and senior citizens. However, we continue to ask that this happens. Wherever lines are managed by the police, we would have 2 lines formed, one for senior citizens and essential workers, and one for regular workers, regular persons. We ask that continue. Other businesses adopt that policy and provide the preference to those persons, particularly those who are in uniform, those essential workers who are in uniform, police officers, nurses, fire officers, soldiers. Because if they're in uniform, most likely that they just steal the time from their job and they need to get back to their job. And we don't want to unnecessarily keep them away from the jobs. So we ask that businesses provide this service to our senior citizens and essential workers, and create a line specifically for them so that they could transact their businesses and get back to work quicker.
Thank you, Superintendent Henry. This question has been long in coming, and it's for Dr. Wilkinson. If someone has symptoms of the coronavirus and that person has sexual intercourse with someone else, can they get the coronavirus? Please educate us.
Let me see if I can put the question about the coronavirus and sex to rest here. Since coronavirus and the institution of quarantine and curfews, etc., the sales of condoms have increased significantly across the globe, especially countries that have shut down. A lot of pharmacists also are saying that the sales of things like Cialis, Viagra, etc., they have increased. Some persons are buying them even more than Tylenol that one would need for fever. We know, however, that the coronavirus is present in respiratory secretions. So if you cough or sneeze, then the droplets that come out, the virus can be transmitted. We also know that the virus is transmitted when someone is in close contact with someone else. And close contact is defined as less than 6 feet. And so I assume that if someone is going to be having sexual intercourse, there would be less than 6 feet within that distance of the person. And so just by being within 6 feet of someone, that can put you at risk for catching the coronavirus. We also know that since it is transmitted through droplets, if you are kissing, then you're basically exchanging saliva. And that is much more significant than the few droplets that will come out of your mouth if you cough or sneeze. And so that would put you at risk. We, however, do not know whether or not the virus is present in vaginal secretions or the semen to any significant level to be transmitted during the act of physical intercourse. However, if you're concerned about catching the coronavirus and your partner has any respiratory symptoms, my advice to you is to avoid any close contact or having sex. If you're concerned that your partner might be asymptomatic and you don't want to catch the coronavirus from that person, my advice to you is to avoid having sex. If you are concerned about catching the coronavirus from sex at all, then I suggest that you wait until we get a vaccine, which is another year or so. So that's my advice to you as it relates to sex. So thank you.
Thank you, Dr. Wilkinson. As we can see, the coronavirus is affecting everything. It's affecting people's sex life. That's just how it is. This question, does this COVID-19 situation bring to light the need for the national health insurance? More need, or bring attention for us to have here in St. Kitts and Nevis, national health insurance. The second question, do companies or employers have the legal right to forcibly determine that every 24-hour lockdown day will be deemed to be an employee vacation day? This is the situation being faced right now by employees of one of our major companies as of yesterday, 24th April. This is unethical, at the least, and unfair to the hard-working men and women whose well-deserved vacation days are now threatened, and also their jobs if they speak out. Attorney General.
Good afternoon to everyone. The last question, of course, has to do with our labor laws, and one would want that we approach the Labor Department for our labor professionals there to be able to advise us. We are in a very critical state of emergency, and some businesses have been forced through a downturn in terms of economic activity to maybe ask their employees to take vacation. Some of them may well make their employees redundant. And so these are the realities of a market economy. But in some cases, it may well be that there is a violation of what the existing labor laws are, and one should get your representative at the Labor Department to discuss these matters with you on a basis, one-on-one basis, depending on what the situation may well be. The first question was related to national health insurance. And yes, the national health insurance is a program that has been investigated, and proposals have been before the government for some time. A working group has been created, and quite a lot of work has been done in this area. The basis of the national health insurance is to be able to assist all our citizens to help ease the burden in terms of the payments for medical care. It also allows us to better manage programs that the medical fraternity and the government can work out, so that there will be some programs that are clearly going to be dealt with by the public purse, others will be subsidized and so forth. But this, like everything else medical, is a program that is intended to assist us when it comes to address the health of our nation. So yes, it is something that would help to cover a lot of this in terms of when cases are presented, in terms of how these would be treated and paid for.
Thank you, Honorable Attorney General. This question has to do with Avalon Lab. Mr. Moderator, I have been advised that the Avalon Medical Lab is equipped to perform COVID-19 testing. However, we only hear of Next Gen Lab as the only lab being used to do testing. How can Avalon become a part of the local testing team? After all, they have been around long before Next Gen Lab and should also be supported and considered. Dr. Wilkinson.
Just before I answer that question, once I got back to my seat, my phone was going off with questions about what I just said about COVID-19 and sex. And someone asked me one question, which I think I should share. They asked me if I think using a condom and an N95 mask and having sex is safe. And I would say yes, I believe that that is the safest route if you don't want to, if you don't want to catch sex with that. As it relates to Avalon, I'm sorry to be laughing. As it relates to our Avalon Laboratory, I can tell you that my office is very close to Avalon Laboratory, and I haven't heard anything from them. One of the first things that I'll do on Monday is to find out if they are in fact offering this test. I doubt it very much, but we welcome all persons on board, and if there are any private labs that are offering the PCR test, I'm pretty certain that they would have been the first to contact us. Thank you.
That brings us to the end of our question and answer segment for today. I would like to thank you very much for your questions, and I do hope that they were adequately answered, especially the ones that, of course, you know, people are interested in and have a lot of interest in. The numbers that were provided before by Mr. Samuel for the banking are for people who reside overseas, not people who reside here, but people who reside overseas. I would like to thank you for your questions, and we would like to thank you, of course, for each day continuing to tune in, to be updated, and to be informed about what is happening in St. Kitts and Nevis with respect to the COVID-19 pandemic. I would like to thank Mr. Ron Collins, Permanent Secretary in the Ministry of Transport, for sharing with us. Superintendent Cromwell Henry, may he continue to enjoy his birthday, well deserved. He's always here. Chief Medical Officer, Dr. Hazel Laws, Mr. Abdias Samuel, our Attorney General, Honorable Vincent Byron, and Dr. Cameron Wilkinson, Medical Chief of Staff at the Joseph N. France General Hospital. Thank you very much, and tomorrow we will be back at 5 p.m. for another daily briefing. Until
Officer
then,
Donnelly.
be safe. And if you have to wear your mask and you have to wear your condom, please do so.
Liebert Shiverton. Do you want to travel and don't have private transportation? Here are some travel safety tips to keep yourself and the persons around you safe from the coronavirus. When venturing out in public, it is recommended that you wear a mask at all times. Sanitize your hands before and after entering public transportation. The bus operators are also encouraged to sanitize their buses after each trip. Remember, always practice good respiratory hygiene. That means refraining from touching your face with unwashed hands. Always practice physical distancing. To maintain physical distance, the government of St. Kitts and Nevis stipulates that only 2 passengers are allowed per row. That is, 1 passenger on each end of the bus row, while 1 passenger is allowed to sit up front with the driver. This means that only 9 passengers are allowed in a passenger bus. Remember, stay safe, travel wisely as we work together to flatten the curve.
Fear of the coronavirus, along with misinformation about its spread, could lead to stigma and discrimination towards people contracting the disease, their families, and even healthcare workers. Stigmatized people may be subjected to social avoidance, bullying, and acts of aggression and physical violence, which could have a detrimental effect on their mental health. To help reduce stigma and its impact, you can share accurate information about the virus and how it spread. Speak out against negative statements shared on social media sites and don't share such videos. Don't refer to coronavirus victims or cases. They are people with COVID-19. Do understand that stigma and discrimination make it harder for people to seek care for the disease. Do your part to reduce fear and discrimination. Be responsible with what you share. This message comes to you from the St. Kitts Mental Health Association. The coronavirus pandemic has caused upheaval in the lives of many people, and the increased stress that it has caused is a very normal response. High levels of stress impacts people's physical health, how they feel, and how they think. To help manage stress during this pandemic, it is important to stay up to date with credible sources of information about how to keep yourself and your family safe, maintain connections with family and friends while remembering to observe social and physical distancing. Practice relaxation techniques like deep breathing, yoga, meditation, stretching, and relaxing visual imagery. Focus on positive aspects of your life and any new opportunities that this situation is bringing to you. Engage in physical activity, even in your home. This helps to boost mood and reduce levels of stress. Stress levels can be managed by having a problem-solving approach, by managing the things that you can manage, and by adopting a positive attitude about your capabilities. This message is brought to you by the St. Kitts Mental Health Association.
Ladies and gentlemen, may I present Team COVID-19. Step into the mic in the studio is Dr. Laws, our beloved CMO, Medical Chief of Staff, Dr. Wilkinson, and Mr. Lesroy Williams. Team COVID-19 on the front line, coming to you in Calypso rhyme. So sit back, relax, and listen to what they have to say and the role they want you to play. Easy.
Early in January this year, our federation woke up in fear because a little virus out there in Wuhan was slowly making its way to our land. They say its name was SARS Corona, and our lives it planned to devour. So we're here to come up quickly with a little plan to save our beautiful nation.
Plan they want, then plan they will get. Because of people's lives we have to protect. Close down the airport and send back them big tourist ships so we could focus on this pandemic. Mr. MCS, I'm begging you please, as I pray to God from down on my knees. Now let's get all our hospitals and staff in order to battle this corona.
Well, Madam COO, I hear you loud and clear. We will win this fight, don't worry, don't fear. I'll sound the alarm and get all hands on deck. This war we will win and our people protect. To win this war we must flatten the curve, but don't overwhelm the nurses and doctors. Personal responsibility you must take indeed if we are to succeed.
Cover your mouth, we say cover your nose. This will stop the spread to those who are close. Lock yourself inside during the curfew. Under quarantine, to thine own self be true. Wash from your elbows down to your hands with soap and water, it's a simple plan. If you follow these simple instructions daily, from this virus we'll soon be free. Easy! Now I know what you're thinking, but I only assisted with the recording. This song is not my composition, but brought to me by Dr. Wilkinson. Between Hillis Roy and the CMO, they've come up with this great KISO. So after whipping COVID-19 behind, there'll be Sugar Mass 49.